Hi, I'm Dr. Dave Griffin, a foot doctor, also known as a podiatrist. Our video today will discuss how to do a daily foot check if you or a family member has diabetes. Did you know that if you have diabetes, you have a much higher risk of infections on your feet that could lead to amputations? In this video, we will show you how to protect your feet by doing a daily foot check. Why is it important to check your feet every day? Because you can catch a small problem and get help before it becomes a big problem. On the left is a normal appearing foot, but it has a small ingrown toenail just starting on the big toe. On the right, the ingrown toenail problem that was not noticed early has become a serious infection and is spreading up the foot. By performing a daily foot check, you can catch a small problem early and get help right away before it becomes an urgent or emergent problem. Here are 4 things to remember to protect your feet. 1. Check your feet every day. 2. Wash and dry them carefully. 3. Wear shoes that fit properly and always wear socks. And 4. Never walk barefoot indoors or outside. Start by checking your feet at the same time every day so it becomes part of your routine and it gets easier with time. Be sure to check the top and bottom of your feet, your heels, and in between your toes. Many people have trouble seeing the back or the bottom of their feet. Here you see Maria using a mirror to check her feet. Make sure you have plenty of light so you can see well. Another helpful technique is to put the mirror on the floor as Don is doing here. This is more comfortable for him so he can clearly see the bottom of his feet. Fortino is checking his feet. He carefully checks between his toes. This is important because the hidden spaces between your toes are where cuts, cracks, and fungal infections can start and often go unnoticed. Of course, if you have a family member or friend who can help you check your feet, that is wonderful. Maria's husband, Jose, is looking for any cuts or sores, blisters, calluses, swelling, redness, or anything else that looks out of the ordinary. By doing foot checks every day, changes in appearance that could represent a problem are noticed right away. That is why it is important to check your feet every day. Notice that Jose is checking the feet, bottoms, tops, and in between her toes. Another key is to wash your feet every day with warm water, not hot. If you have nerve damage from diabetes, you may not feel hot water that is too hot and might burn yourself. Before washing your feet, test the water with your elbow or a thermometer first. This is also why you should never use a heating pad or a hot water bottle on your feet either. Sit in a stable chair on a dry, non-slip floor with a secure basin to help prevent falls. Wash briefly, do not soak, and be sure to dry your feet well, especially between your toes. Nick has a stable seat in his bathtub. He can sit and wash his feet easier when taking his daily shower. He carefully uses a soft washcloth with soap to wash, and then he rinses his feet well in warm water. Nick dries most of his feet while sitting in the bathtub. Then he carefully steps out of the tub. He steps onto the towel to dry the bottom of his feet. You can see that his slippers are right there waiting for him. He puts on his slippers before walking to the bedroom. Nick never goes anywhere barefoot, not even from the bathroom to the bedroom. Nick's wife, Kathy, helps him in drying in between each of his toes and checking for cracks, sores, or fungus. It is very important to keep the spaces between your toes dry. Please avoid putting any creams or lotion in between your toes because too much moisture in these areas causes problems. Don likes to use a chair and a basin to wash his feet daily in the bathroom. We recommend everyone sit down to wash their feet to avoid the risk of falling. Don carefully dries both feet thoroughly and especially between his toes. After his feet are nice and dry, Don puts moisturizing cream on his feet, making sure no cream gets in between his toes. Shoes that fit you are a very important part of caring for your feet. Shoes that are too tight or too loose can rub or pinch and can cause blisters or sores without you feeling it happen. You will see here that Don is getting his shoes checked for the right fit. There should be plenty of room for your toes to spread out and not rub against the inside of the shoes. Always try to check to get your shoes properly fitted by a professional or have them checked by your doctor. Please remember to always wear socks with your shoes to protect your feet. Here Don is showing us a very helpful tip. Before putting on his shoes, notice that Don is shaking out his shoes. He is checking to make sure there is nothing inside the shoe like a rock or stone that could hurt his foot. If you have numb feet due to nerve damage from diabetes, you may not feel something in your shoes like a stone that could poke you or rub your feet and cause a blister or a sore. Give your shoes a good shake before putting them on. Like many people, Nick has trouble reaching his feet. This can make putting his socks on more difficult. Nick has purchased this special device to help him put his socks on by himself. There are tools that are available if you are in a similar situation. Ask your doctor to help you find the right tools for you. Nick also uses a shoehorn to help him put on his shoes. Many people find a shoehorn very helpful, and you might too. Nick has special shoelaces in his shoes. They are elastic and have a special clip so that he can tighten the laces without having to tie them. These laces are very helpful for people who may have limited feeling and dexterity in their fingers. Our last and maybe most important recommendation, never go barefoot, and not even for a few steps inside your home or even walking from one room to the next. Nerve damage from diabetes can mean a loss of feeling, so if you step on something sharp like glass, you may not feel it. So, whether you are just walking from the bedroom to the living room, or the living room to the kitchen, or stepping out to the porch for just a moment, or heading out for a walk in the neighborhood on a sunny day, never go barefoot. Protect your feet. This is why your eyes have to do the checking every day. And if you see a problem with your daily foot check, get help. Not every foot problem is as urgent as others. Here is a guide to help you in contacting your foot doctor or diabetes care team. Let's start with some conditions that you should get checked soon. If you notice any of these, make an appointment soon to get checked. Tingling, burning, or numbness. Thick, yellow toenails. Fungus or athlete's foot. Dry, cracked skin. Shoes that do not fit properly. If you have corns or calluses or an ingrown toenail, please remember, never try to treat these conditions yourself. Do not use any chemicals or sharp blades on your feet to try and remove them. Instead, if you have any of these conditions, contact your foot doctor, diabetes care team, or local clinic to make an appointment soon. Some conditions are a little more urgent. Call right now if you see a new blister, cut, or open sore. Redness, warmth, or swelling. Fluid, blood, or pus coming from a sore. A black or blue color change to the skin, or a hot swollen foot, even if it does not hurt. Do not wait. Call your foot doctor, diabetes care team, or local clinic today. Some conditions need immediate attention. Go to the emergency room now if you notice redness of the foot that is spreading quickly, feelings of confusion, or fever or chills, or if you simply feel very sick. Do not wait. You need medical care now. These problems could risk your life or a leg amputation. Go to your nearest emergency room right away. If you have a choice, a hospital with a diabetes or wound care team may be able to help you faster. Daily foot checks matter, but they do not replace a professional foot exam. Everyone with diabetes needs a complete exam at least once a year, even more often if you're at high risk. And if a family member notices a change or encourages you to get checked, please listen. Early care protects your mobility and independence. Why don't you try a daily foot check right now? Check the top of each foot, the bottom, the heel, and sides, between every toe, and then check inside your shoe. If you cannot see or reach your feet on your own, simply ask yourself who can help you check. Checking your feet every day protects your mobility and independence by significantly decreasing your risk of sores and amputations. It is important. You can do it. You can download this reminder sheet and keep it somewhere you will see it every day. Please see the link in the video description below.